Welcome to Sleep, Sex, and Senility, where we explore the fascinating connections between sleep, oral health, cardiovascular health, hormones, brain health, and longevity. I'm Dr. Kathleen Carson, an oral systemic focused dentist.
And I'm Dr. Ellie Campbell, an integrative physician focused on prevention and healthy aging. Together, we bridge the worlds of dentistry and medicine to uncover how the health of your mouth may influence the health of your entire body.
If you enjoy these conversations, please like and subscribe to the podcast so that you never miss an episode. And if you'd like to stay up to date on new episodes, emerging research, and practical health insights, visit our website and sign up for our monthly newsletter using the link on our homepage.
Now, let's dive into today's conversation.
Before we begin, a quick note. This podcast is for educational purposes only and does not provide medical advice. Please consult your own healthcare provider for recommendations specific to you.
Welcome back to Sleep, Sex, and Senility, where we connect the dots between oral health, sleep, hormones, inflammation, and whole body wellness. I am Dr. Kathleen Carson, an oral systemic and airway-focused dentist.
And I'm your other host, Dr. Ellie Campbell, an integrative and family physician. Today's conversation is about how fertility starts with inflammation you can't see. Fertility, not the way most people think about it. Fertility about changes that start months, sometimes years before conception is even considered, and often in places where nobody's looking. So let's imagine a couple trying to get pregnant. They're tracking cycles, they're taking supplements, they're downloading their fertility apps, they're monitoring their ovulation, they're scheduling their intercourse. They're doing everything they've been told to do. But nobody looked at their sleep. Nobody looked at their inflammation. Nobody looked at their oral health. And nobody looked carefully at the future father's health. That's more common than more people realize.
Yeah, so let's start with the most important message of today's episode. So we're not here to tell you that gum disease causes infertility. The science doesn't support that claim. But fertility does not happen in isolation, and pregnancy does not happen in isolation. Hormones don't operate in isolation. The body functions as an interconnected system. And inflammation, that will affect your entire system.
Yeah.
So the mouth is one of the places where inflammation is often visible, measurable, highly modifiable, and typically overlooked.
Yeah. Fertility depends on an astonishing number of systems working together. Hormones, ovulation, implantation, blood flow, immune regulation, metabolic health, mitochondrial function, sperm production, cellular signaling, and inflammation can influence every one of those processes, not necessarily causing infertility, but potentially creating additional obstacles. And that's why I think fertility really is less of a reproductive issue as it is a whole body health systems issue. So here's a good example. One of the best of this understood conditions that people pretty much know about is called PCOS. Now, interestingly, this month, experts changed the name. They're now calling it PMOS, and that stands for polyendocrine metabolic ovarian syndrome. And honestly, I think that's a better name because the old name focused on the ovaries and it neglected the many orchestration of other organs that were involved. The ovaries kind of take the hit in the end, but they're not the cause of the problem. And many women now with this new name recognize that we suffer other symptoms: insulin resistance, chronic inflammation, hormonal imbalances, weight gain, trouble ovulating, sleep disturbances, increased cardiovascular risk, increased liver health risk. So the ovaries are important because they're often where the symptoms appear. Many of those other things have no symptoms. But the root cause frequently involves metabolism, inflammation, hormones, insulin dysregulation, and sleep. And that's why focusing on fertility misses the bigger picture. So here's something many women don't know. Women with PMOS are at an increased risk for sleep disordered breathing and obstructive sleep apnea. Poor sleep worsens insulin resistance. Insulin resistance worsens hormone dysfunction. Hormone dysfunction affects ovulation. Ovulation affects fertility. It's a giant interconnected web. And this is why improving sleep can be such an important part of a couple's fertility journey. So, while we're talking about fertility, can we please stop pretending that this is only a women's issue? I'm a family physician and I learned that babies are made by two people. Yet fertility conversations almost entirely focus on one. Male factors contribute to infertility far more often than people realize. Sperm health matters, sleep matters, inflammation matters, metabolic health matters for both partners. Inflammation and oxidative stress can affect sperm count. Did you know that across the world, men's sperm counts have decreased by 50% in the last 40 years?
I did
Sperm
not know that.
motility is profoundly affected by environmental toxins. Sperm shape, morphology, and swimming ability is affected. DNA integrity and testosterone production is dropping about one per year. Men are not spectators in fertility, they're participants, and their health matters every bit as much.
Yeah, and this is actually where the oral health can enter the picture. Your mouth, it's one of the largest reservoirs of chronic inflammation in your entire body.
Yeah.
So, bleeding gums, that's inflammation. Periodontal disease, that's inflammation. Chronic oral infections can contribute to inflammation. And unlike many risk factors, oral inflammation is often highly treatable and often ignored. So, what really interests me is that women with PMOS frequently also have higher rates of periodontal inflammation than women without it. So, again, we need to be a little careful because it's an association and not proof of cause and effect, but it reinforces that idea that the mouth is participating in the same inflammatory conversation that's occurring throughout the rest of the body. And on top of that, researchers, they've also found associations between periodontal disease and adverse pregnancy outcomes. And a lot of times obstetricians and dental organizations, we encourage women to enter pregnancy with healthy gums and healthy oral tissues whenever possible. But sometimes this is a really big missed part of the conversation still. And this is simply good preventive medicine. It's good preventive dentistry and it can help with fertility issues.
Yeah, and I think that this is really where honesty matters, right? Because can we say that treating gum disease improves fertility? Well, not definitively. Can we say that improving sleep guarantees pregnancy? Of course not. Can we say that reducing inflammation eliminates every fertility challenge? Absolutely not. That's not the point. These are modifiable risk factors, just like having adequate magnesium because you need magnesium to ovulate. You have to have enough progesterone to support implantation. You have to have enough vitamin D. Fun fact, vitamin D makes follicles. Did you know that if you're vitamin D deficient, I can make you bald? You don't get hair follicles. You also don't make ovarian follicles. So getting your vitamin D level adequate is an important strategy. It's not just one thing. We have so many resources that people spend, emotional resources, physical and financial, diving into fertility. Sometimes simple modifiable factors like progesterone levels, vitamin D levels, oral health, these deserve attention first.
Yeah, so it sounds to me like we can kind of compare fertility to gardening. You can't force a seed to grow, but you can improve the soil it's trying to grow in. You can improve the water. You can give it more sunlight. You can take away the weeds. You can create healthier conditions, and that's really what we're discussing today. Better conditions.
Yeah. So if I was going to design a comprehensive preconception plan, I would look at sleep quality and metabolic health, blood sugar and insulin regulation. I'd look at nutrition, not only, the diet diary and what they're actually eating, but the micronutrients. Are they getting into the cells the way that they're supposed to? We have blood tests for many of these. We do a hormone evaluation. We now have apps that people can do their home hormone testing every single day of the month for about the same as one blood test. cost in the office. So we're getting better technology for hormone evaluation, screening for PMOS with abdominal ultrasound, pelvic ultrasound, looking at those ovaries, looking at the liver, making sure all the organs are healthy, taking an adequate exercise history, working on stress management, inflammatory markers, and yes, of course, an oral health evaluation because fertility does not occur in a vacuum. It occurs within this whole biological environment.
Yeah, and let's not forget about the future dad. Let's come
Yeah,
back to the men one more time
right.
because fertility planning, you got to involve both people, right? So if you're planning a pregnancy, both partners should be evaluated. Oral health, sleep quality, nutrition, metabolic health, inflammation, lifestyle habits. You know, healthy pregnancies begin long before conception and with both partners.
Yeah, for sure. So imagine a couple hoping to become pregnant 6 months from now. Instead of waiting and hoping for the best, maybe they can be empowered and decide to optimize what they can control. They can improve their sleep, they can address their snoring, get tested and treated for sleep apnea. They can work on improving their nutrition, getting rid of processed, ultra processed food. We can work on reducing inflammation, managing insulin resistance, maybe wearing a continuous glucose monitor to keep ourselves accountable to what's going in our mouths, treat the periodontal disease, get a dental evaluation, exercise consistently. Can we promise pregnancy? No. But we've been shown in my office to improve the biological environment in which pregnancy will occur. I've had over 30 years, over 100 babies born to women who were told they were infertile by working on these root causes and getting rid of the impedances and supporting the body for what it was naturally meant to do. Because this is a worthwhile investment in your long term health, regardless of the outcome.
Yeah, and as the dentist in this conversation, one thing I want you to take away from this is that preconception health really needs to include an evaluation of your mouth because oral health, it's one of the most modifiable inflammatory levers we have.
For sure. And if PMOS has taught us anything, it's taught us that fertility is not just about the ovaries. It's about metabolism and sleep and hormones and inflammation and the environment that the body's operating in.
Yeah. So if you're planning a pregnancy, add oral health to the conversation for both partners. Have your gums evaluated, address bleeding, address inflammation, address infection.
And ask the bigger question: what can we improve today that will make us healthier parents tomorrow? That's where the real preconception health begins.
Thanks for joining us today. We'll see you next time on Sleep, Sex, and Senility. I am Dr. Kathleen Carson.
I am Dr. Ellie Campbell. Don't forget to like and subscribe. We drop our new episodes every Tuesday. Go to our website, sleepsexandsenility.com. Sign up for our newsletter. We'd love to have you on our mailing list and let us know what you want to hear about. We've also decided to shrink our episodes a little bit. We can get kind of long winded, and we've decided, based on your input, that we should create some shorter episodes. So let us know if you like the short ones or the long ones better. We're here to make you have the best sleep, sex, and senility experience possible. Thanks for listening.
Nanoverse Media, making the world smaller.